Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and you're watching my YouTube channel. Today's video would be a continuation of our videos on COVID-19. And today's topic is about the long-term effects of COVID-19 in those people who have acquired a COVID-19 infection. Before we proceed, please subscribe to my channel and share the video. And if you like it, please press the like button. So COVID-19, like any other illness, has its long-term ramifications on the human body. Any serious illness leaves its mark on our bodies. Some less, others more. So COVID-19 is a systemic illness which does leave its mark based on the recent studies. And there was a recent article about the long-term health consequences of COVID-19 infection published in Journal of American Medical Association on 5th of October. So there is those people who survive this infection. Studies from Italy indicate that they do have some degree of damage. Some people have more, others have less. Whether it is the severity of infection, the initial insult, or it is the chronicity of infection, it's likely that some people who develop serious illness that requires oxygen supplementation because of the pneumonia or severe acute respiratory distress, or who are admitted in the ICU, may have more consequences or more chronic illnesses. There's another hypothesis which is idiosyncrasy, which means that some people are susceptible to the chronic effects of COVID-19, no matter how severe the infection is. Whether it could be mild or it could be moderate or severe, it is their inherent susceptibility towards COVID-19 which can lead to long-term effects of this illness. And the organs could either be delayed in healing, or they may have sustained more trauma. And the hypothesis is that the virus may persist in certain parts of the body, like olfactory nerve, which controls our sense of smell, and may continue to damage the brain by infiltrating the brain tissues. Or people, they may not be able to fight off infection at certain parts of the body. And whatever the location, there would be long-term effects. And these long-term effects could be chronic COVID symptoms, which would be post-acute COVID, which could be persistence of some degree of COVID symptoms after 3 weeks of illness, meaning most people would recover in up to 2 to 3 weeks. But if it's beyond 3 weeks, is post-acute COVID-19 infection. And then the chronic COVID infection in those people in which the symptoms have persisted beyond 12 weeks of illness. So the other things which have been shown is that in some people there is that profound cytokine release syndrome in which your revved up immune system continues to damage multiple organs. And some of the organs may be damaged because this persistent overactivation of immune system will lead to autoimmune illnesses. And the autoimmune illnesses are which have been shown to have increased after the COVID-19 are like diabetes, new onset diabetes. And usually the hypothesis for diabetes is that sometimes the viruses, they have antigens similar to our own cells the molecular mimicry, where antibodies made against the virus can cross-react with human antigens. And in case of diabetes, it is the beta cells in the islets of Langerhans in the pancreas which are destroyed by these auto antibodies. And those people who have diabetes and they suffer from COVID-19 can have very bad consequences. In previous infections like MERS and SARS, MERS was, remember, Middle Eastern Respiratory Syndrome in 2003, and SARS was Severe Acute Respiratory Syndrome, which were viruses which were not too different from COVID-19. And those patients also developed long-term mental and physical consequences because of the serious viral illness. So in these pockets of areas where the virus lingers on, there could be a slew of effects which would be caused. If it is heart, then they could have chronic heart infection like myocarditis or cardiac arrhythmias, where troponin levels could be high. If the virus infiltrates through the olfactory nerve, controlling the sense of smell, and in the brain, it can cause symptoms from as minor as loss of sense of smell and taste to headache, which could be headaches, could be chronic, dizziness, stroke, which is because of the clotting in the brain. Either a clot is thrown towards the brain or there could be a rupture of blood vessel. It could be embolic or hemorrhagic stroke. Encephalitis, the infection of the brain parenchyma or brain tissue itself, and seizures, which could also happen. The other thing is post-COVID mental health, that you are not able to think clearly, you cannot concentrate, kind of a brain fog like symptoms, which can persist. People can have depression, anxiety, post-traumatic stress disorder, substance abuse, and if they get admitted in the ICU, they could have post-ICU syndrome, which is a severe illness that you develop post-recovery from ICU because you had gone through a very severe trauma and you could suffer from post-traumatic stress disorder. Steroids themselves can have, if the patient received dexamethasone as a treatment which has been proven to show recovery in randomized controlled studies, can also have mental effects. People can have sleep disturbance. That's why when we prescribe dexamethasone or steroids, we try to give it in the morning or the evening since it can impair the sleep. People can have chronic lung disease like severe fibrosis and lung damage, in which lungs don't completely recover, and people can continue to have mild respiratory distress because the lungs have been damaged to that degree that they cannot expand to cause oxygenation of blood. Multi-organ failure, including heart, kidneys, lungs, intestines, all those things can happen. And BBC had done a survey in which people had reported up to 50% of the people who recovered could have symptoms from 30 to 50% post COVID. And one of them was chronic fatigue, which is crippling lack of energy after the COVID infection. And this is not kind of that crippling or lack of energy that people can recover from, like daily fatigue and tiredness. Joint pains, breathlessness, persistent cough, fast heart rate, hearing and eyesight impairment, loss of taste and smell we discussed, and multi-organ damage, depression, anxiety, and the brain fog that we have already discussed. There was another study which was done in outpatient setting in which symptoms duration and risk factors for delayed return and usual health among outpatients patients with COVID-19 infection. And they were the people who were out of work beyond 14 to 16 days of illness. And there were 274 people in this study done in Italy, in which 35% of people had some degree of delayed return to work. And overall, when you break down into age groups 18 to 34, 35 to 49, and 50 and beyond, most of the people who were younger, like under 34, up to 26% patient had delayed return, and up to 49, 32% had delayed return to work. And people who were beyond over 50, they almost 89% of people had symptoms beyond 2 weeks of illness. So these are the chronic effects, which are there and cannot be overlooked, and they indicate that this disease may have chronic effects in those people who have recovered. The lucky thing is that in this outpatient study, there were less people who had, up to 1/3 of the people in people under 50 years. So if you are under 50, up to 1/3 people can have chronic effects. However, if you are older, over 50, up to 80 to 90% of people can have delayed recovery from COVID-19. So the prevention is the focus at this time, which means mask wearing, hand washing, social distancing, quick contact tracing. Anyone who becomes positive, has symptoms, tested positive, should be isolated until he or she recovers, so that they don't become super spreaders. So later on, vaccine could be the fifth line of defense. And if all these 5 things are combined, hopefully the prevention against the illness would be higher and more successful in preventing the illness. And when would it go away? It may take 1 to 2 years, and hopefully a good vaccine comes out in next few months, which will further augment our efforts to contain, restrict, and ultimately eradicate the illness. If you have learned anything from this video, please like and share this video. May Allah bless all of us and protect our families. May God bless you. And Allah Hafiz. Sallallahu alayhi wa alihi wa ashabihi wa sallam. Assalamu alaikum.